So I became a family physician for several reasons. One of the reasons was growing up, I never had a consistent healthcare provider that I connected with. My father was in the military, and we moved around a bit. So I never saw the same provider more than once often. So one of the things that attracted me to family medicine was to be able to build a relationship with patients over time. And the relationships are very special to me. They're built on trust, and the patients need to feel that they can trust me with some very personal information, and I take that very seriously. The other reason I enjoy family medicine is because I get to work with all ages, starting with kids all the way through patients who are 99. I also enjoy the fact that I see a variety of conditions, from strep throat to high blood pressure to diabetes to removing sutures for different reasons. So it keeps me on my toes. The HPV vaccine protects against certain strains of the human papillomavirus that are linked to cervical cancer in women and genital warts and oral warts in both men and women. The vaccine is it's to prevent infection. So it's important to get the vaccine prior to exposure, meaning prior to sexual activity. It's a series of 3 vaccines. It's usually very safe, and it's indicated for people between the age of 9 through the age of 26. Most doctors target the age of 11 to 12 to start the vaccine. Most schools require kids to have a pre-sports participation physical exam. It's an opportunity to screen kids and adolescents prior to playing sports of any kind in terms of possible risk factors for heart disease or risk factors that may include high blood pressure, orthopedic issues. It's basically to ensure as well as we can that somebody can participate with sports with safety. I oftentimes use that chance of meeting with the child or adolescent to screen for all kinds of things, including making sure that the immunizations are up to date, making sure that they don't engage in other risky behavior, talking to them about concussion prevention, whether it's on the sports field or court, or if it's when they're skateboarding or skiing. As a family physician, I get the opportunity to treat both older patients as well as young patients. I oftentimes see my older patients more frequently than my younger patients because the older patients tend to have more chronic diseases. My younger patients, I oftentimes see them once a year for a well visit prompted by mom or dad. In terms of the adolescents, oftentimes I see them once a year for the well visit and a pre-participation sports physical. Through the age of 18, up until the age that oftentimes the students go off to college, I see them on a regular basis. Then there tends to be a drop-off of appointments, late teens, early 20s, maybe the patients go off to college and are not locally, or they start a job and may not have health insurance. But I do believe it's important to maintain a relationship with a primary care doctor, to continue the routine screening and to make sure they're up to date with immunizations and the blood tests that are normally done.